already know me from our last sessions, and also we talked to you in the Aging Asia booth as well. And I'm Konomi. I'm co-founder of Kotobuki, and I'll be your host for today's webinar as well. And today we'll hear again from Dr. Tomoki Kaneko, and he is a founder of Kotobuki and a researcher who has been studying the quality of care in Japan, especially from sociological perspective. And we are so glad to welcome today's participants and for those joining us for the first time as well. So we hope this session helps you better understand how Japan's long-term care insurance system works. It's a really basic idea of what kotobuki-care stands for. And this webinar is actually co-hosted by Aging Asia, who is our international marketing partner to share the knowledge of care innovations in Japan to the world. Okay, and yeah, you can go to the next slide. If you have a chance to share it with us, that would be great. We really appreciate if you can share on the chat where you are joining from today and what you want to learn from this webinar, because we only have a few people today and we want to make this webinar really interactive. So that's great if you could share your interests as well. So first, we'll share a bit about our nonprofit corporation Kotobuki, who we are and what we do. And then we will move on to today's main topic. We will explore Japan's long-term care insurance system, and it's an innovative care model in Japan. And also we will share the emerging challenges and the future hopes, because Japan is a super aging society, and we will also talk about some of them as well. And finally, we will have a time for a Q&A session, so please feel free to drop your questions in the chat anytime you want. So first of all, who we are and Kotobuki. We are Kotobuki. It is a non-profit corporation led by two researchers, which are me, myself, and Tomoki. And we are a group of researchers who have spent the past 10 years combining religious researches with hands-on practice in the field of elder care, and has built an extensive network of care facilities across Japan. So through the research papers and book publications and workshops as well, we have introduced Japan's most innovative care practices to our global audience, which we will introduce you today as well. So first of all, who we are and what we do. We offer three core services. First, webinars like this, and also online articles to introduce innovative care practices across Japan. Also, we coordinate on-site visiting program, like study tours to a variety of care facilities, the unique facilities in Japan. And third, we also offer a training program for care operators and caregivers to actually implement the essence of kotobuki care from Japan into their daily practices. So we offer both in person and in online learning opportunities. That's what we do. And yeah, this is basically who we are and what we do. So now I would like to hand it over to Dr. Tomoki.
Thank you, Konomi. Can you hear me? Okay. Okay, wait a minute. Okay. So, good evening, everyone. I'm Tomoki, co-founder and CEO of Kotobuki. My background is sociology, and my research focuses on the quality of care in Japanese elderly facilities. Today, I'd like to give you an overview of Japan's long-term care insurance system. I'm not a policy expert, so I want to go in technical details. Instead, I'll give you a big picture of how the system works. As we shared in the first webinar, before year 2000, caregiving in Japan was very different. First, caregiving was seen as a family responsibility, especially for women. Second, there was no user choice. The government decided who could get care and what kind of support they could receive. And third, caregivers often faced a heavy burden. Many people had to quit their jobs, and caregiver burnout and elderly abuse become social issue. To respond to these challenges, Japan introduced a long-term care insurance system in 2000. From here on, I will refer to it simply as the system. The core idea is move from depending only on family to a system where society shares the responsibility. In Japan, this change called the Socialization of Care. The Long-Term Care Insurance Act has total 14 chapters. It's a very long document, so I want to be going into the detail today. If you like to read the full text, you can download it here. The website also provides English translation of many other Japanese laws as a healthcare insurance. So, feel free to explore if you want to know more. Okay, so let me start by sharing the core objective of Japan's Long-Term Care Insurance Act. The Tokyo Metropolitan Government has provided a helpful summary, so I'd like to share that with you. The object is to realize a society where everyone can live safely and elderly people can live independently in accordance with their ability while maintaining their dignity. So let's now to take how system actually works. This diagram shows how the system works. The elderly apply to the local government for care certification, often with the help of family member or care manager. Once approved, they receive the care services from providers. The process is supported by coordination between local government and service providers. The system is funded in two ways, through tax and insurance premiums. People of age 40 and over pay the premiums. Taxes comes from both national and local government. So let's take a look who covered under this insurance. There are two categories of insurance person under Japanese long-term care insurance system. They are based on age and health condition. Category 1 covers people aged 65 and over. They can use care services once they certificate as needing support for or long-term care. Category 2 is for people aged 40 to 64 who are enrolled in a public medical insurance scheme. They eligible only if their need for care comes from one of 16 aging-related diseases. In both categories, a service begins after getting certificate by the local government. Now let's take a look at 16 age-related disease recognized under category 2. These are conditions that can lead to long-term care needs, even for people between the age of 40 to 64. Some examples include terminal cancer, young onset dementia, stroke, and ALS. If someone between the age of 40 to 64 is diagnosed with one of these conditions, and they are officially certificated by the local government, and they can receive long-term care services just like those aged 65 and over. In Japan, long-term care service information is available in online. Anyone can compare, provide, and choose one that fits their needs. But in reality, care manager often guides this process. They play a central role in helping people navigate and system and receive the right support. Since care managers are such an important part of Japan's care model, so I would like to introduce them in more detail in the future session. The Tokyo Metropolitan Government has created an easy understand pamphlet for residents that explains the long-term care insurance system. So if you want to know more, you can download it from here. Okay. So next, let's take a look at how the needs of care assessed in Japan. To start using care services, people must first go through an official assessment by local government. There are 7 levels in total. 2 levels of support required for those with lighter needs, and 5 levels for care required for those who need more continuous assistance. The type of service you can receive differ between these 2 categories. People with care required level generally have access a wider range of services than those with support required levels. Now that we've seen how care levels are assessed, let's take a look at kind of services available under the system. Japanese systems are broadly divided in 2 main groups. First, home-based and community-based services, which support people who continue living at home. Second, facility-based services for those who need full-time support in a care facility. As of 2025, users can access up to 54 types of services, grouped into 26 categories based on the type of care and where it's provided. The 26 services categories are quite complex, and even in Japanese, the names are long and hard to remember. So we won't go into these services today, but I want to highlight one important point. People certified as support required can only use service marked as preventive in this chart. On the other hand, those with higher care levels labeled as care required can access a much wider range of services. So you may remember our care I introduced in several times in my webinar. It's officially part of a Japan long-term care system. Our care is one of the type of multifunctional in-home care, especially classified as small-scale multifunctional home care. The name is a bit long, and even Japanese, it's hard to remember. This service combines 3 functional that used to be separated: day service, home care visit, and overnight stays. It offers more flexible and personalized support, but operating is quite complex. Many facilities struggle to make full use of these struggle to make full use of what this service can offer. Our care is one of the few that had truly succeeded, and it is well known as for putting this model into practice. Since there was no official video introducing a Japanese system in English, however, there are videos that introduce concrete services and care practices. So I'd like to share the short video here. In this video, the term nursing care is used. This refers to what I usually call long-term care. Okay, so let's start.
Introduction of nursing care in Japan. Nursing care services in Japan provide support for walking, toileting, eating, and bathing to people with difficulties in their daily activities due to old age, mental or physical disabilities, or other reasons. In this video, we introduce the characteristics, service structure, and overview of nursing care in Japan, as well as professions related to nursing care. There are 2 critical concepts in nursing care in Japan. The first is support for self-dependence. This means not only providing care, but also support that can enable those who require nursing care to make use of their own abilities as much as possible. The second is the preservation of dignity. This means constantly observing whether service users live their desired lives and providing tailored care and support. Next, let's look at the structure of nursing care services in Japan. In Japan, people can receive nursing care through public long-term care insurance by obtaining government certification. Two types of nursing care are available depending on their person's condition. The first is services in facilities or residences, in which patients move into a care facility to receive 24-hour nursing care. The second is in-home services, in which a person lives at home and either visits a nursing care facility or has a home visit from care workers. These nursing care services are provided by collaborating with various people, from inexperienced to certified nurse care professionals, doctors, and nurses. Various people work together in Japan to provide services that integrate medical care, nursing care, and daily life support to create an environment where people who require nursing care can continue living in a familiar community and lead their desired lifestyle. We call this the community-based integrated care system, an essential characteristic of nursing care in Japan. Japan experienced an aging society earlier than other countries and has accumulated a lot of expertise in nursing care that can be used in other Asian countries with aging populations. Since Japan's nursing care aims to enable people to live their desired lifestyle, the concept of support for self-dependence is very important. To achieve support for self-dependence, care workers not only take care of an elderly person's personal needs, but also help them live each day using their own abilities. By maintaining people's physical functions and abilities for daily activities, we aim to prevent them from needing long-term nursing care. Even if long-term nursing care does become necessary, we try to prevent further deterioration of their physical and mental functions and aim for their recovery as much as possible. There are 5 key elements in nursing care for supporting self-dependence so that older people can live a healthy and independent lives in their familiar community as long as possible while respecting their personalities and lifestyles. The 5 critical elements for supporting self-dependency are ensuring sufficient intake of nutrition and water, maintaining physical functions needed for eating, keeping physical functions required for using the toilet, securing a level of physical activity that is within the person's ability, and identifying and appropriately handling any decline in cognitive function. Initiatives for supporting the self-dependency of older adults are being widely implemented in nursing care settings across Japan. Next, let's look at what types of nursing care are available in Japan. Services available through Japan's long-term care insurance can be classified into 2 categories. The first is facility or residence services, in which people move into a care facility. The second is in-home services, in in which people live in their own homes and either visit care facilities or receive home visits from care workers. These services can be classified further according to the degree of necessary care and its purpose. For example, individuals who require constant nursing care and are not suited for in-home care are provided with integrated nursing care that includes meals, bathing, and toileting at an intensive care home for older people under facility services. An example of in-home services is home visits. A care worker periodically visits the home of older person or others needing nursing care to assist with meals, bathing, and toileting. A care worker also performs household chores like laundry and cleaning. People of various professions work closely together to provide these nursing care services. This includes not only care workers, but also those who provide medical care like doctors and nurses, rehabilitation experts like physical and occupational therapists who support patients' recovery and self-dependency, and those who support meals and daily activities like dietitians and cooks.
So thank you for watching short video. We talked about Japan long-term care insurance system so far today. But that doesn't mean the system is a perfect success. In fact, Japan is now facing a major challenge, the so-called 2025 program. In this year, the baby boomer generation will turn 75 or older. That means nearly 18% of the population will be in the late elderly group. As the number of people need care rise, the system alone can no longer keep up. Japan is now facing a serious challenge on the front line of aging. We are seeing a shortage of staff, a decline in the care quality, and even the bankruptcy of some care facilities. Many family members are leaving their jobs. That shows how hard caregiving is for both families and care workers. But even in this situation, there is a hope. A small number of facilities and care providers in Japan are finding a new way forward. They improve the quality of care and also increase staff satisfaction and support people with dignity, even at the end of life. We call this sustainable and human-centered approach kotobuki-care. We showed a video of our care in the last session, but this time I'd like you to watch it again, now with a context we've just discussed in mind.
ようこそ日本の藤沢へ。私は、株式会社青井ケア代表取締役の加藤忠介です。青井ケアは多くの方の利用者の多くようこそ日本の藤沢へ。私は、株式会社青井ケア代表取締役の加藤忠介です。青井ケアは多くの方の利用者の多くの方たちがほとんどの方は認知症ですが、見ての通りどこにも壁はなく、もうすぐ隣は隣の家という作りになっています。ですがどの事業所も鍵は開きっぱなしですけれども、高齢者がどこかにいてしまって認知症の方が行方不明になるようなことはありません。中は地域の方が普通に通り抜けていきますし、地域の子どもたちの遊び場にもなっているような事業所です。その困っている高齢者を、例えばデイサービスなどでありがちですが、ここに7時間座っててくださいと。 自分が痛くない場所に7時間座っててくださいと言ったら、それは誰でも帰りたくなります。でそれに対して帰りたいというと、高齢者は帰宅願望だと言われ、歩き始めると徘徊だと言われます。しかし高齢者はそれに対する正しい反応をしているだけです。ですので我々はその困らない状況を作ることがケアだと考えています。アウケアで、認知症のケアをするにあたって一番大事にしているのは2つです。1つはデザインと1つはケアの手法です。1つ目のデザインに関しては、簡単な話です。日本人の多くは多分病院に誰かのお見舞いに行ったら15分で帰りたくなります。それは病院の中の視床情報といって目から入ってくる情動刺激が冷たいからです。プラスチックのテーブルに白い床、白い壁、情報というのは脳にとっては心地の悪い情報になります。ですのでどの事業所もそうですが、必ず床は無垢の板を使い、パッと見た瞬間に 70% 以上で、自然素材が目に入るように場所を作るように意識しています。それによってよく F 分の1の揺らぎと言いますが、人間がリラックスした状況でいられますので、常に不安に襲われたりとか帰りたくなるような環境を作らない。簡単に言うと、私がいたい場所をちゃんと作って提供するということを意識しています。もう一つはケアですが、できないことを、例えば日本で折り紙や塗り絵をずっとやらせるような事業所もありますが、多くの人はそれをやらされたら嫌がるはずです。ですがそれは福祉の発想で、かわいそうだからやらせてあげてるですよね。そうではなく、自分が得意だったことや好きなこと、趣味、そういうことをちゃんとこちらが把握した上で、お願いする形で教えてくださいという態度で、高齢者に接すると、お年寄りは困らず我々にいろんなことを教えてくれます。ですのでお年寄りが誰も困ってない状況になると、認知症はただの高齢者になります。ですからお年寄りが全然認知症に見えないというのは困ってないからです。
Thank you for watching video. And we are often asked whether our care mainly service people with low care needs. But actually, the average care level of our care user is around level 3. In Japan, many care facilities tend to accept only those with lower care needs or only those with higher care needs. From a business perspective, taking in more people with care level 5 would mean more income, but it also means more pressure on the staff. At our care, it's different. It's different. People with a wide range of care level live together and support one another. They each have roles to play and create a shared living environment. No big budget, no high-tech device, and no extra hands. This approach doesn't just improve quality of life. It has also helped reduce the use of long-term care insurance services, continuing to an estimated annual saving of 10 billion yen, around $70,000. We hope to expand and share this kind of kotobuki-care. We believe that this approach to care is meaningful not only in Japan, but also across Asia. It has taken Japan many years to get to this point. But by introducing kotobuki-care earlier, other countries may be able to avoid some of the challenges we have faced. That's why we keep sharing Japan's care practices and policy challenges through online articles and webinars. We also handle the logistics, including translation, transportation, and matching you with care facilities that align with your interests and needs. And finally, for those who want to practice what we introduced today, we offer the kotobuki-care training program, both online and in person. So this is all for today. Thank you for joining us today's session. Before we move to the Q&A session, we would like to really appreciate if you could take just a minute to fill out feedback form. And also, if you haven't already, please show your expression of interest of the July tour through the same link. Thank you.